Okay, great. So hi everyone, and welcome to today's Q&A panel. Today we have some students from Medicine and Biomedicine. I'm Sarah, and I'm a third year medical student here at Monash, and I'm part of the Faculty of Medicine, Nursing, and Health Sciences. So I'd like to start today by acknowledging the traditional owners of the land on which we are meeting, and pay respects to the elders past, present, and future. So today I'm chatting to some of our medicine and biomedicine students to find out a little bit more about their degrees and what it's like to study at Monash Uni. So after they finish speaking, there will be an opportunity for the audience to ask questions. Though please ask that you avoid asking about entry requirements in particular, as this will be better addressed by school booths. So joining us today, we have Charles Ruan, who is studying a Bachelor of Medical Science and Doctor of Medicine through the direct entry pathway. We have Sep Roshanai, who is also studying the same course, but through the graduate entry program. And lastly, we have Alexandra Churchill, who is completing her Bachelor of Biomedical Science. So now it's on to them to share a little more. So I'll pass it on to them to introduce themselves and give us like an overview of their degree and study experience here at Monash. So let's start with Charles.
Hello everyone, my name is Charles. Like Sarah said, I'm currently a second year student studying Bachelor of Medical Science and Doctor of Medicine. I'm actually an international student from China, and this is my fifth year studying Australia. I chose to study medicine at Monash because the direct undergraduate medicine degree here has a really good reputation, and it is the shortest medicine course in the country. I really love the direct medicine course mainly because of how the cohort sticks together as a group all the time and help each other out all the time. You might have heard about in uni in general, you only get to see your peers during class and everyone just disappears after class. It's very different here in medicine. We stick around after class, we go to events together, study together, and hang out together. The culture here in medicine is so inclusive and friendly that everyone just goes out of their way to share resources and help each other. During my free time, I participated in a number of social and sporting events that Monash had on offer. I was involved in the Monash social sports and competed in the futsal and basketball competition. It was a really fun experience, not only because of the competitive nature of the sport, but also the fact that it gave me something to look forward to each week and allowed my mind to switch modes once in a while. Besides, joining different clubs and societies is another way of meeting new friends and getting involved. There are just so many clubs that Monash offers, and you could really find a club for whatever hobby you have. As for medicine, MUMUS, which stands for Monash University Medicine Undergraduate Society, is a society where you're automatically signed up to when you start your medicine course. MUMUS is involved with pretty much every aspect of your medical student life. It provides you a bank of student career resources, offers you a variety of social sporting events, as well as supporting you with their mentoring program. There are also a number of sub-societies that belong to MUMUS, and you could further pursue your passion that is more relevant to medicine. I would encourage every new first years to check out their website and get involved in the opportunities they offer. The most exciting part about studying medicine during your clinical years, that is your first and second years, to me had to be the placement, in my opinion. In my first year, we had two placements, one at a GP and the other one at the hospital. During the GP placement, I got to see a range of different patients with different conditions coming into the clinic for help. It was very interesting to hear the conversations and see the interactions between the patient and the doctor. After each consultation, the GP I was with patiently explained to me the conditions of that particular patient and told me about the potential treatment options. It was a very informative day and really enabled me to see how a general practice actually operates at a daily basis. At the start of this year, I was looking forward to my second year rural placement. Sadly, however, due to the COVID situation, they've all been cancelled and we're doing 100% online learning at the moment. Transitioning into university is a huge task, and no doubt everyone faces challenges at certain stages of our lives. I found it hard to adapt to learn well in the university, especially in my first semester. In medicine, we were lucky enough to have a group of second years who volunteered the time to organize extra peer support programs after university to help us summarize and consolidate our learning. I was also fortunate enough to live on a campus community where there are resident advisors and peers to ask for help and socialize with. In terms of campus and the university community, our medicine course is based on Clayton campus, and you have the opportunity to enjoy the wonderful facilities that are located on this huge campus. You have access to a wide range of services on campus, including various restaurants, pharmacy, post office, university GP, as well as gym and recreational center. The Monash University PTV bus loop is super convenient and could help get you to most places. I stayed on campus with Monash Residential Service, and it has also been a wonderful environment to spend your university days in. In short, Monash is a fantastic university, and I absolutely enjoyed my experience so far. I would highly recommend anyone who's interested to join this vibrant and supportive community. Thank you very much.
Great, thank you, Charles, for that. I think it was really interesting to hear your experiences. I completely agree with many of the highlights of medicine you've touched on. Thank you for that. Cool. Let's hear from Sep now.
Hello, I'm Sep. I'm also studying Bachelor of Medical Science and Doctor of Medicine. I'm currently in my year 4C. And as mentioned by Sarah, I went through the graduate entry into medicine. So I completed my Bachelor of Biomedical Science in 2017, also at Monash University. And a part of me deciding to study at Monash University for medicine was the pathway that at the time was available to me. I'm not sure if that still applies for 2021, so it'd be good for you to check out the booth for that, for further entry requirements. But for me, that was one of the reasons I decided to study medicine at Monash. It was through the biomedical pathway. And looking back now, having done biomed, a lot of what I learned was very good foundation for me going into medicine. And it was really good to have also my peers who was also studying biomedicine to go through medicine with me as well. So you already had this community and all these people you already knew going through with you, which was really good. And especially because in your first year of medicine in the graduate entry, you have to go to Churchill in Gippsland, which is about 2 hours drive from Melbourne. So you spend your whole year there, and it's your preclinical year. So it's all your theory stuff. And basically you're living in rural Victoria for a whole year, and having your cohort there is one of the best experiences. And it's one of the experiences that you only have once in a lifetime, and I wouldn't change it for anything. You basically get to live with all your best friends. You get to hang out all the time. You study together. You do a lot of social things, and it's one of the best parts of graduate entry at Monash. And I'm currently in my second year of clinical placement. So last year I was in the hospital the whole year full time. I did medicine rotations and surgical rotations. So that's basically my general medicine rotation and my specialties. So cardiology, oncology, respiratory, all your medical specialties. And then there's the surgical specialties that I had, which were plastics, orthopedics, and ear, nose, and throat. And you get to be really part of the team. You get to go every morning, depending on the round, so 8 a.m. or 6:30 a.m., and you get to go with the team. You get to see patients. You see how they interact with the patients and how they conduct their investigations and how they treat them. And also you get to do some hands-on stuff as well on placement. So you get to take some bloods, even scrub into surgery, and see how the doctors actually operate on patients. On placement, it's not just the medical parts of it as well. It's learning how hospitals work and the health system works. Learning to communicate with your nurses and your allied health is a really big part of it. And it was a very steep learning curve at the start. But now being in my second year of placement, it's been really good having had that exposure in my previous years. And I think Monash does this really well by really focusing on placement from early years to try and make sure that you are well equipped once you become a doctor. So my placements this year have been a little bit all over the place because of COVID, but faculty have been really good in communicating with us and making sure that we're safe on placement. And it's been quite tough for a lot of people being at home, being away from family and friends, but the best support that we've had have been through our student reps. So each year level has 2 student reps, and they're really your first point of contact for any issues you might be having. And I know for our year level, our student rep has been really involved, keeping us informed about what we can do if we have any issues, if we feel like we're not safe on placement, or if there anything that is going on in our personal life, that they can be our first point of contact to get us help, essentially. And it's been really good this year, especially with everything that's going on. So medicine's not just all about learning medicine. There's a massive social part of it as well. And as Charles mentioned, there's lots of sports. So each year there's usually a CAD Cup where each year level competes with other year levels in netball, soccer, basketball, and I think there's one other one. And it's one of the most fun days, usually, maybe not so much this year, but everyone gets really involved and you get to meet other people in the other year levels, and it's a really fun day. And obviously there's some competition, which is really fun as well. And there's always other workshops going on. So there's the surgical weekends, there's emergency workshops, which is an opportunity to meet other people in medicine and really get involved in making friends and making connections. One of the best parts about medicine is essentially becoming really good friends with people who are going to be your colleagues. And in the 10 years times when you become a doctor and you're referring someone to another doctor, it could be someone you know quite really well and you have that trust with them. And I think it's a really unique part of medicine, especially for graduate entry, where you've pretty much lived with these people for a whole year and you really, really know them well. And it's one of the best parts of it. And that's pretty much my experience.
Cool. Yeah, thanks for that, Seth. And like, I don't think you mentioned it, but like the graduate entry is like a pretty small group. I think it's only like, I don't know how many, but like.
Yeah, so we actually have in my year level, we had about 100 students, so it's quite small. So you do really get to know each other really well.
Yeah. Yeah, and I definitely learned lots more about the graduate pathway after meeting other graduate students, and hearing your experience in placement was so good because it's such like an integral part of the medicine course. And yeah, the connection between the medical cohort is such a highlight, as like many people have pointed out. Cool. So lastly, we have Alex, and she's speaking about the Bachelor of Biomedicine. So we'll hand it over to her.
Hi, everyone. So thank you for that, Sarah. So my name is Alex, and I'm a third-year student at Monash, Biomedical Science. Why did I choose Biomed? I chose Biomed because coming out of high school, I had a real interest in looking at the medical aspects of really human biology in order to treat humans, in order to make advancements in the biomedical field. And I really wanted to make a contribution to society. And really, I knew that I could do that if I had a really good, solid foundation in all the different aspects of the biomedical sciences, which I'll go into a little bit later. I chose to do it specifically at Monash because, well, our biomedical science program is very well known, and the employability of our students after graduation is really good as well. We also have incredible facilities, just really beautiful high-tech labs, buildings. We have our Monash Biomedicine Discovery Institute, which is a research facility right on campus where a lot of our academics who will actually teach you will then go and do research in this big building. And it's a beautiful building and it's really cool. And you really feel like you're a student, but you're part of a bigger, this big research goal to make advancement in society, make progress in the human sciences, because you're always interacting with researchers, people who are actually professionals in their field. I love the degree. I really enjoy the breadth and the depth of what we learn. So it really gives you an exposure to all the different areas that you would be interested in doing. So if you're particularly interested in one area of science or the human sciences, you get to explore that. And then you get to go in detail into lots of different areas. And then you can also have a little bit of a taste in another discipline in biomedical sciences. So for instance, I remember I really enjoyed my neurobiology unit in first year. And I thought, wow, like this is so interesting. And then I came to second year and I did a genetics unit, and it was so different and also really, really diverse and really interesting. Then I did molecular biology. And so you get to really experience and explore all the different areas, and it can really help you to think about your future. Like, where do I want to go? Maybe I want to be a researcher in this area. Maybe I want to go and be an allied health professional in this particular area, or do something in this discipline. So you really get to explore and have a taste of all those different areas, but at the same time, really go deep into them. So you become really professional and you really gain this wealth of knowledge that's just really remarkable. So I also really, one of the things I really love about biomedical science is just how passionate the academics are. So if you're someone like me who enjoys interacting with academics and people who are very passionate about what they're teaching, then definitely I would recommend biomedical science. The academics who, as I mentioned previously, a lot of whom are researchers who come and they teach you, and then they go and they work in their labs and they work on their projects and they produce papers. I mean, they're really professionals in their area, and their passion and their enthusiasm transfers to the students. So, you can always approach your academics and say, I was just wondering, could you tell me a little bit more about what you do in your lab? You taught us about, for instance, how the heart, how high blood pressure affects the body, for instance. I was just wondering if you could tell me more about your research in hypertension. And they're so willing to engage with you and really willing to speak to you. And it's so nice knowing that you can just approach your academics and they'll be so happy to discuss their work with you. And also, I was really happy about the fact that we have so many opportunities to develop those soft skills. So we have each semester we have a module. It's a professional development module, and it basically involves us thinking about how can we become better professionals. So thinking about, when have I demonstrated problem-solving skills? When have I demonstrated teamwork? Really giving us the opportunity to reflect in such a way that will enable us to become better people, better members of society, because the degree does not only emphasize the academics and understanding the theory and the lab skills. There's also the crucial component of, am I able to network? Am I able to be a functional member of a team? Because research, medicine, allied health, all of these different biomedical areas and medical areas, they all involve you working in teams. And that's such a crucial component, which is really awesome in biomedical science, that the academics really stress these components, these soft skills. In terms of my extracurriculars, there's a wide variety of opportunities to get involved. So I've been part of leadership roles. I've been student rep for biomedical science, 2nd and 3rd year. I've also been ambassador for the Faculty of Medicine, Nursing, and Health Science that biomedical science is in. And really it fosters those crucial, again, those soft skills, ability to work in teams, feeling responsible for something, being organized, of professionalism, whether it's interacting with students or it's interacting with academics or it's interacting with potential students. I've also been involved in the Monash Student Association, which, and in that role, I could really look at what's happening university-wide and how I can interact with students of other degrees to improve student experiences on campus. The Biomed Society, the Biomedical Science Student Society, run entirely by biomedical science students. It hosts barbecues and it hosts functions, and you get to interact with other students from the different year levels. And also I've been part of Monash Hands-on Health, so that's really inspiring the younger generations to get involved in biomedical and medical related degrees. The campus that we're based on is Clayton campus, and it's robust, it's dynamic, it's cheerful, the energy is vibrant. We have a biomedical learning and teaching building, which is a building specifically designed for teaching biomedical science students and for us to have our own study space. We have an anatomy lab in the basement. We have the different study spots which overlook this beautiful, the greenery of the campus. So it's really an amazing atmosphere. And one of the awesome things as well is that you're around students who are just as equally as passionate as you are. And it's so nice to be in that environment where you feel that you're being supported by both the approachable academics and also by the students who have the same drive and the same passions as you do. So those are some of my experiences in biomedical science. Yeah, it's really great.
Cool. Thanks for that, Alex. I think it's really good to learn about all the different and interesting kind of areas that you can explore in your Bachelor of Biomedical Science. Like you said, I think neurobiology, and that sounds really interesting just in the name, as well as the direct exposure you get to research with passionate academics early on. That's really good to hear about too. Great. So now we're going to move on to kind of our last part of our talk today, where we have time for Q&A. So we have time for a couple questions, so feel free to submit any questions you do have. And these can be directed to a particular panelist if you want, or in general. But yeah, cool. So feel free to start submitting those questions now. Just to get started, maybe I'll ask Charles a question. So what do you actually study in medicine? Like, do you study physics or maths, or like kind of what do you actually like learn?
Yeah, I can certainly answer that. I'm afraid if you're one of those math nerds in high school where you just do math all day, all night, that's bad news. You will not be doing any form of math in medicine. However, we do have a wide range of topics that we do like study, including anatomy, biochemistry, physiology, microbiology, pharmacology, psychiatry, medical law as well, and ethics. Also, yeah, the high school chemistry does play a part in the foundation of your biochemistry topic. Whereas if you are asking about physics, I think only the basic concepts will be used in physiology. And yeah, that's about it.
Yeah, I think especially like the medicine course is 5 years. In the first 2 years, it's a lot about like setting the basics, which you talked about. Cool. And yeah, okay, great. So I'm gonna ask Sep a question now. So if you were worried about getting into direct entry medicine, so what are some like positives of the graduate entry pathway?
So the positives, I think I've kind of mentioned already, but basically you get to have this foundation you've already built in your undergraduate degree. So you have obviously this mountain of broad aspects of biomedicine or science or whatever your undergraduate is that you can bring into medicine. It really makes you more well-rounded once you start learning about medicine, even interacting with patients. You really learn, as Alex mentioned, the soft skills of teamwork and speaking in public and giving presentations, and especially research, which is a big part of medicine as well. You really can pick up in your undergraduate degree and apply once you start doing medicine as well. And for Monash specifically in year A, getting to live and be away from home is a huge learning curve for a lot of people, and being pushed out of your comfort zone I found was a really big positive for a lot of my cohort as well as myself. And basically it's the first time for some people living out of home, and it's a really good learning opportunity basically.
Yeah, like every that kind of postgraduate student I've met in my course does have a lot of that like experience that I think you talk about, and it does actually bring a lot to how good like a doctor you're going to be. So I definitely like agree with a lot of the things you've said. Great. So this is a question for like Alex. So what do you actually So what does like biomedical science research involve?
So it's, first of all, it's recognizing that what you do in the lab will translate to and have a direct impact on larger society. So for instance, that there are certain diseases out there in society which have few treatment options, or there's been stagnation in treating certain diseases. But also we have drugs for certain conditions. For instance, asthma is a good example, where researchers really are thinking about what are the ways in which we could produce newer drugs that will be more effective in alleviating the symptoms of asthma, for instance. So one of the things that you can really do in biomedical science is you can choose to do a unit called research in action. And this is a good experience for you to really be partnered with, say, a lab head, a researcher who has a lab at Monash on campus. And it's the opportunity for you to really feel like you're part of a lab. If you're interested in research, but you're not entirely sure if you're going to make a good researcher, you can say, no, I'm going to get this exposure. So apply for a research in action unit, which is what I'm doing this semester. And I'm part of a lab. I'm part of a respiratory pharmacology lab on campus. And really, I'm getting this exposure to what the researchers do on a daily basis. How do they publish their research? How do they make presentations? How do they interact with other people in the lab? How does the lab delegate different opportunities? So really, research is about having a goal. So for instance, I want to explore this disease, and I want to model it in this for example, animal. And research is about interacting with other researchers. What has been done? What can I learn from other people? What are my goals and my strategies for this project? How am I going to delegate responsibilities in my lab? It's also about recognizing I have these resources. How am I going to target them to the appropriate areas? And then, of course, there's the practical element, actually getting down, setting up your models, doing your research, waiting, collecting the results, analyzing the results. But again, research is about, yes, the practical elements, but again, it's those soft skills. It's making networks. It's learning from other researchers before you and teaching newer researchers, just like, for instance, the researchers whose lab I'm in are mentoring me and teaching me. So it's a multidisciplinary role as well. So it's really, really interesting. And it'll be great for you guys to get that experience if you're in biomedical science, that research exposure.
Yeah, like research is so important. Like it underpins everything you do in like medicine and biomedicine. And so like the idea that you can like get involved at an undergraduate level is really, really cool. Great. So I'm going to ask another question to Charles. So you briefly talked about this in your presentation about like the PSP kind of like mentoring program. So do you want to kind of explain a bit more about that?
Yeah, sure. Basically, well, in medicine, there's like a tradition of your senior years teaching junior years, where in our case, when I was first year, so a group of second years, they get together every week, maybe even twice a week. They produce their own slides. They gather people in the tube room, and we probably just came from like a tutorial or something, and then we immediately went into another room where we just learn stuff and consolidate stuff with the second years. Same with in the case of when we were second year this year. However, yeah, even though it's changed to online, but there's still the same group of third years this year would be helping others by producing the slides and then teaching us about stuff that we need to know about. There's also another side of the mentoring programs, which is called the Medicine Mentoring Program. I think there's another one belong to me, it's called Momentum. Yeah, I'm a peer mentor in that. And this program kind of matches the first years into like the senior years, and they meet up weekly and monthly to help to catch up on contents or like just answer any questions you might have about university or medical knowledge or anything that you want to ask about. Yeah, I found that pretty useful, and yeah, I would encourage any first year to look into that space.
Yeah, like I think you kind of talked about the tradition of like older medical students teaching younger ones. And like I'm sure Sep will agree, but like it's definitely continues even like in the workplace, like where doctors will teach younger doctors. And it's just like this kind of passing on of knowledge. And that can start even as like a second year. So like second years can teach first years, third years can teach second years. So like there's always room for you to kind of share that knowledge in a really, really like helpful way. So I think, yeah, like mentoring as well as like teaching is like a really important part of medicine. Great. Sep, so I have a question for you. What if I can't get into medicine? So even through the graduate pathway, but you're still really passionate about helping people. Like, did you consider any other career like options?
Yeah, so when I was finishing my undergraduate degree, I was thinking, what if I don't get in? What can I do? Am I going to keep trying? Obviously, I thought about backups and other paths I can go through. I considered similar things that essentially medicine is helping people and trying to make someone's life a little bit better. And a lot of other health careers include that. So I considered psychology, I considered physiotherapy, and I looked into them and just to see if they interested me as much as medicine did, and whether I could feel fulfilled doing those things. So I definitely did consider other careers. And if you're really passionate about helping people, medicine isn't the only thing that that can do that. Even seeing that on placement, doctors play such a small role in someone's treatment and getting better. It's all the other people that also help that patient recover. And even once they leave hospital, there's so many other people that help them get better at home and stay out of hospital, essentially. So it's not just about medicine. And I think that's really important to consider other careers, because again, it's whatever you enjoy. And if helping people is what you really want to do, medicine isn't the only career.
Yeah, great. I think that's such an important thing to bring up, that like if you want to help people and you want to help patients, even like in a healthcare environment, there's so many different ways to do that, through like nursing, through like speech pathology, physiotherapy, pharmacy. Like the team that it takes to help a patient is enormous, and it goes far beyond being a doctor or anything like that. Even like from the biomedical science end, like who do you think develops those therapies? Like everyone is working together because they want to help people. So I think, like don't box yourself in. Medicine's not the only way you're going to help someone in a healthcare setting. So unfortunately, that's all the time we have for today. So we're going to come to an end of our session. I want to say a big thank you to Alex, Seb, and Charles. That was so important, and thank you for sharing your career insights with us. Thank you to everyone in the audience. I hope you found this session useful and we've given you a good taste of what a degree at Monash Uni is like in medicine or biomedicine. And if you think these courses could be for you, or you have any more questions, feel free to visit our booths and have a chat with our staff and other volunteers. We hope to see you guys on campus soon. Thank you everyone for coming. I hope you all have a great week and enjoy the rest